All right, let's get underway. Thank you all so very much for joining us in the latest of our series of Lunch and Learn sessions. I am Knox Kimberly, and since September 1st, I have had the privilege of serving as the interim CEO for TexProtects. TexProtects is the only statewide nonprofit and nonpartisan organization focused on protecting children from abuse and neglect and empowering families to thrive. We do this through education, advocacy, and partnerships, driving systems level change at the community level, all infused with our commitment to equity. Today is the latest in our series of Lunch and Learn educational sessions, and the first of 3 between now and the end of the year, focusing on important issues for the 88th Texas legislature, beginning today with data and its role in informing decision-making. Our audience includes children's advocates from across the state, key partners, legislative and agency staff, subject matter experts, and a variety of other stakeholders who share a common concern for Texas children, whose well-being truly is the most important investment Texas can make to secure a bright future. I want to extend our appreciation to Children's Health Foundation for their generous sponsorship of today's Lunch and Learn session. And now it is my pleasure to introduce our distinguished panel, beginning with one of my TexProtects colleagues, Jen Meyer, who is our research and data manager. And then Dr. Jill McClay, my friend of many years, who is the Director of Policy, Advocacy, and Research at the Reese Jones Center for Foster Care Excellence at Children's Health. And then finally, another of my TexProtects colleagues, Carrie Judice, who serves as our Child Protection Policy Manager and has also been a friend for quite a number of years. In fact, Carrie, Jill, and I have had a number of conversations over the years about data and so forth when I was in my prior role at Upbring. So how we're going to proceed today is that each of our panelists will present for around 5 minutes on a topic, and I think I'll further introduce each one as they come up. We're going to begin with Jen, who is going to talk about why data is essential and how does it help inform policy decisions. And we have a tradition on these Lunch and Learns, and I want to continue that tradition. And that is that at the front end, please say just a few words about what drew you into this work. So Jen, why don't you take it away and be our opener here? Thank you.
Yes, thank you, Knox. And I am very excited to speak with you and the rest of the panel today about a very exciting topic, data. So first, what drew me to the work? I think for me, really just the idea that children are our future, and it is so important to build a healthy foundation from the beginning. And when it comes to data, that really speaks to what these kids are going through and how can we improve the system and the supports available to children and families by looking at the data. And so with that in mind, as Knox mentioned, I'm going to be talking about why is data important in this work. And first and foremost, data can be a powerful tool for telling stories about the state of child welfare in communities across Texas. It provides a layer of accurate, reliable information that often reflects what child welfare professionals observe firsthand on a day-to-day basis. However, data also plays a critical role in identifying gaps and areas for improvement so that providers and advocacy groups can pivot their work to address the most pressing issues facing Texas children and families. With real-time data in the right hands, decisions at the system and community levels can be better informed and more equitable. Data also helps us to set benchmarks or target measures so that we can track progress towards set goals, and make the necessary adjustments over time to achieve our desired outcomes. But it is important to remember the context in which data is consumed, because data at face value does not always paint a complete picture and can mask key differences among specific populations. So disaggregating data enables us to uncover disparities among subgroups that do not always appear when the data is averaged together. Two examples of this include disaggregating data by race and ethnicity, and also by geographic region. When we think about Texas, Texas is a massive state with a diverse population. So it is important to take those factors into consideration when using data to inform decisions around child welfare programs and policies. And finally, we must recognize that data does not operate in a vacuum, and that the lived experiences of children and families should also be incorporated into the decision-making process.
We had a small technical glitch, at least for me, in that I was unable to hear Jen's presentation. And I'm not sure why, but in any event, I could tell. Yeah, see, it's at 100%. Well, while we try to figure that out, thank you very much, Jen. And I know we'll have some questions. And I neglected at the front end, this is my first time doing this, so please bear with me in this setting at least. Once we have our panelists make their brief presentations, I'll have a few moderator questions to pose to spur conversation. And then we will have time, of course, at the end for questions from the audience. So please feel free to put your questions into the chat, and we will try to get to as many of those as possible. So our next presenter will be Dr. Jill McClay. And I gave her title, but her depth of experience in this arena of the utilization of data is quite extensive. And so I am sure you will enjoy hearing from her as she discusses how is child welfare and well-being data applied, and where has that succeeded or failed to bridge the gaps in the system and in the work. Dr. McClay, welcome, and it's great to see you and have you with us.
It's great to see you too. And Nat, you asked us to start out by saying what drew us into this work. So I often tell people, I get asked that question a lot, and I say, I'm what happens when a social worker and a pediatrician have a child. So, and that is the case in my family. But the challenges of children and families, while they were dinner table topics for me growing up, I also worked in direct care with teenagers for several years, and really struggled with seeing some of the systemic issues and challenges that they faced. Which then led me to pursue a master's degree in public policy, which then led me to want to better understand the research that was driving policy. And so that's kind of how I got into this world. And Knox, I hate that you couldn't hear Jen, and it sounds like you probably maybe can't hear me either, because she did a fantastic job of laying a foundation for understanding why we're talking about data today. I thought it might be helpful if I just take a minute or two to give a few examples of just kind of how this plays out in the real world. And I thought I would begin, because I know we have some folks that are advocates, but we have some folks that are practitioners, a real mix. And I just thought I would give one very practical example from a quality improvement study that we did at our center recently, evaluating our mental health treatment. So as mentioned, I work with the Reese Jones Center for Foster Care Excellence, and we provide integrated care, medical and behavioral health care for children that have involvement with the child welfare system. And so we wanted to look at, how are we being effective with the mental health treatments that we're utilizing? And one thing that we learned from really examining the data and looking at the outcomes, was that with parent-child interaction therapy, which has a very strong evidence base for helping caregivers manage behavioral concerns with children, we found that many of the families didn't complete treatment. And most often it was because the child moved before treatment could be completed, because PCIT can take up to 20 weeks, sometimes even longer, to finish. And so sometimes, there'd be a placement change. Sometimes it was a placement breakdown before there was time for that process to be completed. So that led us to reach out to the National Child Traumatic Stress Network. And they told us about a pilot that was underway at the University of California at Davis called PC Care, which is basically an abbreviated version of PCIT. It can be completed in about half the time, can be completed with a wider age group. It's a promising practice. So we're excited. We actually, because we had reached out, because we did this research, kind of looking at our data, we were able to get involved with the pilot. And so now, we've gotten our team trained and we're starting to collect data on, hey, are we seeing the outcomes that we want to see with this abbreviated option? So, I think this provides, an example of where gaps or challenges can be identified by examining the data. But I also think it highlights the importance of having that culture of data where you're not worried about the repercussions of imperfect findings, right? We could have said, oh, we're offering this evidence-based treatment, and so we're doing a great job, check the box. But we really need to look at, is it the right treatment for this population in this place, in this context, with these patients? And so, we really had to see this as an opportunity for improvement, right? As opposed to looking at this as a potential downfall or something that we had done wrong. Another example I wanted to give is from the work with the Region 3 Foster Care Consortium. So very recently, the data committee of the consortium partnered with the Texas Alliance, and Valerie Hallam, I don't know if you're on the call, but I have to give her a huge shout out because she did tremendous work with our data committee to develop a regional profile. And the committee had recognized that child welfare data are often presented really as kind of point in time data. And we often get that point in time data long after the time period that the data actually cover. And so what the data committee really wanted to do was to show trends. Let's look at the data over time. Let's see where we're headed, what's changing, but also wanted to show the most recent data possible. So wherever possible, into 2022, into July, August, September. And so what this report did was it provided a lot of important insights, but it also raised a lot of questions, which in turn raises a point I wanted to be sure to highlight and thinking about where data has failed to bridge gaps. There is a difference between research or data and meaning making. So data in and of itself doesn't tell us everything we need to know. It's an important tool, as the example above that I just gave you showed, but you have to have some context. And so with that data isn't just the numbers, right? The raw numbers. Data is also context. And so with that in mind, the data report that was produced by the consortium was designed to be a tool to help us understand where we are so we can figure out what is needed. That expression about the goalposts, always moving. I think in child welfare, it's the goalposts, it's the field, it's the referees, it's everything is constantly moving and constantly changing. And so we have to be able to be nimble and move with it. But to do that, we have to have the data. We have to be having conversations within, collaborations, cross-sector collaborations to really understand what's going on so that we can design interventions and policies that best meet the needs of the children that we're all here to serve.
Jill, thank you very, very much. And, your comments bring to mind for me, when we think about just how much has changed over these last several years with the pandemic and the fact that workplaces don't look or feel anything like they did before. Well, if you're dealing with 2-year-old data, if it is not timely and real-time data, then you may be way off in terms of what is needed at the present moment, given that kaleidoscope effect of all the moving parts that change so rapidly. And I know that we'll get into the culture around data further when we get into the questions. Thank you so much. And I did get to hear this segment. So again, thanks to some technological wizardry here in the office. Now we're going to turn to Carrie. And Carrie's topic is about data utilization and a little more granularity perhaps around what is in store for the upcoming 88th Texas legislature. So what can be done to improve data utilization and what are we going to do about it in the 88th? Carrie, please take it away. Thank you.
Yeah, thanks, Knox. So I know in keeping with the tradition of what led me to this work, I think there's probably several of you on the call who've heard me talk about this, but for those who I haven't met who have joined us today, in my former life, I was a CPS caseworker. So I worked at the department for 8 years. And I think that direct work with families is ultimately what got me on this trajectory to want to work in public policy. You know, I saw a lot of the red tape that was there. You know, it was policies that we would run up against or laws that we would run up against that ultimately were the barriers to serving our families well. And, you know, I remember thinking in one of my last few years there of how reactive everything felt. And I kept going, is anybody working on prevention? What can we do here? And so that really led me to go, how do I get into that space? And ultimately, when I left the department, ended up going back to grad school, getting my master's in social work, eventually landed in the Senate, where I got a lot of really great knowledge on the legislative process, built a lot of relationships there. It's actually where I first met Knox. You know, from there it was, you know, okay, what's my next step? And then I was very fortunate to land on this amazing team at TexProtects. And so, you know, I definitely can see that trajectory there whenever I kind of look back on life and my profession. But so now I'll kind of get into the, you know, the question is, well, what can be done? You know, and what are we doing this session? Well, I think the simple answer is a lot needs to be done. You know, but it's the reason why I say that just so plainly is because we're talking about kids, keeping kids safe. We're talking about supporting kids and families here. The system that's in place to do so is in a perpetual state of crisis. And I think a lot of us on this call know that. It's been, you know, just kind of one thing after the other for quite some time. We've all heard the stories. You know, we're hearing about children without placement. We're talking about high turnover rates, families not getting the ongoing supports that they need. And on top of that, a federal lawsuit that's been going on for quite some time that revealed that the state has placed kids at an unreasonable risk of harm. But I want to stop here and say before I keep going, this is not to shame anyone. This is not to ridicule, but rather it's to point out that something isn't working and there has to be change. And we know that there's a lot of pressure on the system to change. We see that in the move away from that statewide one-size-fits-all kind of approach to one that's really being driven by communities. And so a lot of you on this call probably know what that means. It's community-based care. That's the way that this system is heading, or CBC, as you may have heard, because we love all the acronyms in this field. And, you know, and Jill kind of touched on that a little bit because we worked together on that Region 3 Foster Care Consortium. And so again, you're starting to see this shift towards communities. But, you know, really to know where, you know, changes are needed, what's going well, what isn't. And then for the people doing the work on the ground and making the decisions at that, you know, the policy making level, we have to have a culture of data that's transparent, efficient, and effective. And so that really leads us into, you know, our work here at TexProtects. And Knox actually, don't know if he meant to say this, but it's, you know, that's really where some of this started, was with the pandemic, whenever we were starting to get calls saying like, hey, what's going on right now? And as, you know, it used to be, we only would get data once a year updated and published on the DFPS website. And so to really be able to like hone in on, well, what's happening now, or when did we start seeing trends change, we couldn't answer that question. And so, you know, our data work kind of started there, but I've always kind of thought of our data priority and just this need for better data in 3 buckets. First, there's what's the data we already have. that we need more frequently. So you just heard me talk about that annual data that we really want to be able to see in real time. That second bucket, I would say, is more like, what data don't we have that we need? And I know a lot of folks on this call, including Jill, we've talked a lot about kinship. And just what information we are and aren't able to ascertain from, like, why are people failing home studies, or why aren't people wanting to become licensed, or just some of that, again, that more specific data. And then the third, which Jen kind of alluded to earlier, again, was that those target measures. What are we aiming for so that we can know, did we achieve it? And where's the progress? And so, again, thinking through those buckets has really kind of been what's shaping our data priority at TexProtects. And so last session, I think many of you on this call probably remember we had a data bill that we were behind. And we were thankfully very successful in getting a budget directive to make sure that for the next 2 years, that we would have monthly information. So again, more of that real-time data. And so we were really excited to see that, but really now, we want to make sure that that continues. And so honestly, we're just going to be picking back up where we left off. And we hope that we can make a little more progress this session.
Excellent. That was a great 3-word summary of what a healthy data culture should include: transparency, efficiency, and effectiveness. And that is a perfect segue to my first question, but I'm going to pose this question to Jill. And I'm going to ask you, Jill, describe in your view whether the culture of data in the Texas child welfare and well-being system is transparent, efficient, and effective. To what degree? And if not, what can we do about it? What can we do to improve it?
It is a great question. I think one thing to remember, I think we all know this, but I feel like it's still important to reiterate that when we talk about a child welfare system, it's a little bit of a misnomer, right? Because it's a lot of disconnected pieces. And so we have our Department of Family and Protective Services and Child Protective Services that are, state mandated to play a very important central role, but we also have the courts and the legal system. We have CASA, we have healthcare, we have schools. And so really, when we think about our child welfare system and kind of a culture of data, I just want to kind of, expand out and recognize that, I think people often think that it's, to Carrie's point, that it's some type of like attack on, the way things are being done. And I think it's important to reiterate that we all have a responsibility and play a role in that child welfare system. So with that being said, I think that creating that effective culture, I don't think we have yet a culture that really prioritizes data sharing and that really puts the importance on data and the meaning making process, right? I kind of like to distinguish those two, but so we don't really have that culture that uses data to create meaning in a constructive and collaborative way. I think we have to end this culture that we currently have of protectionism or self-preservation, and really focus on what we should be focused on, which is promoting child and family well-being. And I often like to use the example from healthcare. And we all know, healthcare does not have it perfect by any stretch of the imagination when it comes to a culture of safety. I think anyone who's listened to the Dr. Death podcast knows that things still happen. But if you're a podcast junkie like myself. But in 1999, the Institute of Medicine of the National Academy of Sciences, they issued a report that was entitled "To Err is Human: Building a Safer Health System." The impact of this work was a change in social norms in healthcare. That's a change in data culture, right? The social norms is the data culture. So prior to that, physicians didn't make mistakes. And there was any questioning of that assumption. They met in private and they discussed them in privileged environments. They didn't acknowledge mistakes. They did not to patients, not to the media, and for fear of malpractice suits. But what this report did was it acknowledged that 100,000 patients died in our hospitals because of human error. And it laid out a path to create a safer healthcare environment. And so what we saw was less than 2 decades later, a huge decline in hospital-related deaths. So that new normal, that new culture of data is to acknowledge mistakes, to get feedback from patients on their experiences. That part that I think Jen so nicely raised of people with lived experience, right? Including that feedback, and analyzed how they occurred and implement changes where changes were necessary. So it's now practice in many institutions when a mistake is made, they're acknowledged internally and publicly. It's not about shaming the person who made the mistake, right? It's not about catching someone on an off day. It's about making sure that our systems are such that it is hard for errors to happen. And it's about learning from those mistakes. So a culture of safety is really fundamental for avoiding patient harm and emphasizing the improvement in systems rather than blaming individual people. That kind of, you may have heard that term, just culture, right? It's moving away from that punitive environment to one where we're saying, hey, if that mistake happened, then there's a problem with the system. And what do we need to do to fix the system so that that mistake can't happen again?
What a great example of what happened with the health system and back in the 1999 and thereafter. And it has been a culture change, and it's a great example that shows that culture change is possible. It doesn't have to always be this way. Jen, in your work, I am sure you have encountered cultural barriers to being able to carry out your endeavors. Do you want to offer an example or two of those barriers and to further illuminate the nature of the cultural challenge?
Yes, absolutely. I can speak broadly to, just trying to request and collect and even view data on the DFPS website. I think that that's a very clear example of the challenges that I myself have faced, being newer to this sector of work and kind of coming in from a strictly health background, and then coming into the child protection space and navigating the website and trying to discern, as someone who is well-versed and familiar with data, is challenging enough that as someone who doesn't deal with data every day, I can't imagine the difficulties that they have opening up the website and seeing all of these numbers and, different variations on indicators brought up. And so I think, to me, just the accessibility to the publicly available data is a big barrier itself. And, that's where I would say, when it comes to culture shift, I think that us sitting here today having these discussions is the first step, right? And being able to be sort of the middleman, where, we're talking about data and presenting data. We're taking that DFPS data and translating it in a way that is understandable and a bit more digestible, I think, is beginning that path towards hopefully changing the culture across the board. But absolutely, I think that accessibility and digestibility of the data is a huge barrier.
Thank you, Jen. Carrie, you mentioned the human element of this. Why don't you speak a little bit to the humanizing of data and how we use data to tell the actual human stories?
Yeah, I like I said earlier, just remembering, like, when we're talking about needing changes, like what the end goal here is, right? Like, it's about keeping kids safe and supporting families. But, to speak to what Jill was talking about, how, when we see that trends aren't going the way that we would like them to go, or, we're not quite making the progress that we want to make, it's not this negative thing and that's the end of the story. It is these numbers on paper represent kids, they represent families. And so when we can find out either something isn't working or, oh, at some point this happened, we can maybe go in and actually look and say, okay, well, what was going on at that time? Just to kind of bring up something very specific that a lot of advocates are talking about right now is removals being down. So we know, looking at those numbers, that, you know, we have about a 50% decrease in removals over the last year to year and a half. But why? And so, you know, looking at, you know, that's when we have to do that collaborative piece that Jill was talking about earlier, of asking folks, you know, well, what is going on here, and understanding, okay, there's been some changes to internal policy, there's been some changes to the laws, there's been, you know, just different things that are going on, and help us understand. But again, like when something big happens like that, when we have a 50% decrease in removals, you know, we're not just going like, okay, the numbers went down 50%. No, we're talking about, okay, are kids safe in homes? Should these families be receiving more supports, or are they not? So again, I think it's just remembering what the data represents is what's most key, because again, any sort of pivot we can make is going to be important, because we're talking ultimately about kids and families' lives here.
Amen to that. So speaking of kids and families' lives, I'd like to turn the conversation to another incredibly important issue, and that is equity. And our last Lunch and Learn session was all about equity, and we focused on race equity and ethnic equity, in particular, with the terrific panel that we had that day. And, you know, obviously we know that there is a degree to which the data has been disaggregated to better understand those effects. Jen, I think I'll start with you on this one. What does the data say about the presence or absence of equity in Texas, and what can be done to better utilize data as we work to promote equity in the work?
Absolutely. So as you mentioned, and as I alluded to earlier, the data doesn't tell the whole story about the state of equity in Texas. And there's a much more complex story to be told when we look at the data disaggregated. So the Department of Family and Protective Services recently released their fiscal year 2022 disproportionality and disparity analysis report. And the data really reveal large disparities, particularly between African American children and white children in the state. And so I can dive into just a few of the numbers to give you a picture, but really what we're seeing in one summary sentence is a disproportionality of African American children in particular in the system. And so some of the numbers are, compared to white children in Texas, African American children are 1.9 times more likely to be reported, 2 times more likely to be investigated, and 1.7 times more likely to be removed. And so we also see that although Hispanic children had similar or better outcomes compared to white children across many counties in Texas, most of the largest urban counties had negative disparities for Hispanic children compared to white children. So again, seeing that disproportionality, that disparity between children of color in comparison to white children, although these disparities among Hispanic children are less pronounced than those observed by or for African American children. And then I just wanted to allude to, Carrie mentioned that removals are down, but one interesting statistic is that while overall removals for the state are down by 40% from fiscal year 2021 to 2022, for African American children specifically, removals are only down 31%. So again, we're seeing this disproportionality where African American children are being kept in the system in a more disparate manner. And to your other question, Knox, around how can we use this data? I think one, there is a layer of, yes, to some degree there is disaggregated data available, but I think that we need to do a better job of making more disaggregated data available. And then two, I think it's doing reports like these. It's calling out the disparities and the disproportionalities, and really being intentional in these analyses and bringing that to light. And so I think that this report is just one example of how we can do that and really make that information known. So as to Jill's discussion earlier, providers can use that data and act on that data and address the issue in the communities, because every community is different and they're composed of different populations. And I think just being aware of what the state looks like as a whole, but also to the extent that we can, getting more granular data of the communities themselves is another big component of that.
Thank you. So in hearing that, it seems that the data is very clear that the disparities and disproportionality that exists is racial in nature. And so I think this has pretty much been the story for at least 20 years and probably much longer, that is what the data has consistently shown, and not just in Texas, but in the nation as a whole. So, when you see that, you hear that, you immediately go, okay, well, clearly we're not getting to the root causes. I was in a conversation yesterday, and Carrie, I'm going to ask you about this because there are several steps in the process of a investigation and removal that begins with a mandatory reporter that goes through an investigative process, and then a decision to remove, courts, et cetera, et cetera, et cetera. And my question for you, based on your experience as a former caseworker and all of your amazing experience at the legislature and with this organization, do you see the data being disaggregated in a way that gets to the heart of those root causes and our ability to assess what is happening that continues to cause this extreme level of disparity and disproportionality?
I think the way I would answer that is a simple no. But I think that I'm trying to think of how I would describe it. Yes, we are able to break some information down by race and ethnicity, but we have not had this targeted approach to make sure that we are looking into these numbers. So like to the point that Jen was making about shedding a light on the issue and actually having like a team dedicated and across systems to address this. So I would say the way we've approached it, at least in the last 6 or so years, has been, we just know that the data is there, but I don't know that we're actually doing anything with it. And here's what I'm going to say about that and why I say that. I do want to give credit to the department, because I remember being in the Senate and learning that the office that was meant to actually address this, actually a targeted approach to addressing disproportionality and disparities, was disbanded back in I think 2017. And so there was no longer this targeted approach. And why I want to give the department some credit here is because they've continued to have a small team on board at their agency to continue to address it. But I feel like the way we've mostly been operating at this point is to just have the data. But I don't know, at least with what is published and what is put out into the world, that we're doing a whole lot with that information. Again, we don't have this targeted approach to show that that is what we value and want to get to the core of. So I'm not sure if that answers your question, but that's at least what came to mind for me.
Thank you. My mute button was sticking there for a moment. Let me turn to another topic, and we're probably 5 minutes away here from wanting to take questions from the audience. So if you could please drop those in the chat, we'd greatly appreciate that. You know, there are lots of different national rankings of the states and their performance in this arena. And last week, the Vanderbilt University Prenatal to 3 Policy Impact Center held a summit and published a roadmap of state comparisons. And as we have seen in other efforts of this kind, the Kids Count report comes to mind. Texas does not fare very well in those comparisons. And so this is really for all three of you. Do you think that that is fair to Texas? Do you think that takes into account the incredible geographic diversity of Texas? And that if Texas itself were geographically disaggregated, would it be a different story, or are we just as in need of across the board improvement as the rankings would suggest? Now I'll let you go in any order on that one.
I'm going to geek out a little bit here, but I do think the comparisons are hard, and I think it's kind of like when we try to compare communities. Even I think it happens at the state level too. It's hard to compare one community to another because one, you've got a selection problem. People self-select into a community, as well as people have to go to certain communities because that's where they can afford to go. And so it's really hard to have all of those controls and structures in place to be able to say it is definitely X policy that is making that happen, or it is Y policy. However, I think that we do see in some states that tend to rank the highest in terms of how they're doing for children, for families, for mothers. We do see some common threads of things that we don't see in Texas. So I'm not completely saying that it's not at all warranted for Texas to have a lower rating when I say that comparisons are hard. And I just want to point out that it can be difficult to make those comparisons when you don't have those apple to apple type things. But there have been a number of studies that have shown, when you have an earned income tax credit, when you have certain payments, when you have expanded Medicaid, et cetera, families do better. There are lower rates of child maltreatment, et cetera. I'm not saying those are the only things. Those policies in and of themselves aren't going to solve our child maltreatment problem, but we do know that they are effective. We do know there's programs and strategies and investments that can be made in states, and those are investments that Texas has not made. And so I do think that some of the concerns and some of the measures that are used by that collaborative are fair, objective measures in terms of, does this policy exist? Are these programs available to families, or are they not? And these are programs and policies that have a strong evidence base for supporting families and thus reducing child maltreatment.
Very good. Jen, Carrie, would you like to add to that?
So Jill, where Jill had kind of started that conversation was just like the diversity of Texas and kind of taking Texas as a whole, when we know even just Austin, the west side of Austin is so different from the east side of Austin and south and north. you name it, it's just so different. But I think where at least what came to mind when you said that for me is, we sit as a number of national calls, and in some ways that Texas is a leader. And I just often think about, when we're talking about data, we can hear all of these like anecdotal stories of all of these really wonderful things happen, but maybe the data or what we're collecting or not isn't really backing that up. And so sometimes I have to wonder, is it a data problem? Are we not collecting the right stuff? Is that really where this is coming from? So I guess just based on my own personal engagement with other states, and again, even in our own, and looking at data and how sometimes the data will show one thing, but it's a little different than what we're hearing on a personal story, family level. So that I do wonder. So I think to answer your question more specifically, Knox, is I don't know that it's taking into consideration all the nuances.
Great. Jen, you want to add anything?
I think that
This
Jill
one?
and I think Jill and Carrie summed it up very eloquently. And I mean, I agree. You just can't always compare apples to oranges. And one of the things that just rings in my head is, not a one size fits all approach, especially when it comes to systems level change. And I think that, there are going to be things that work for others that don't work here. And you just gotta, it's like a puzzle. You just have to find the piece that fits.
All right, well, that was great. And my prompt of a few minutes ago has unleashed a group of great questions in the chat. So we're going to try to get to as many of these as possible, beginning with this one. And I don't know, am I to identify the person who posed the question, or am I to just ask the question that was asked? I assume everyone can see it in the, well, no, actually, no, this is a panelists only chat. So anyway, I will just ask the questions. I think that's probably best. This comes from a social worker who is speaking to prevention and has noticed that the federal poverty levels hurting families are families more than benefiting. Each state and region is different, but the cost of living varies widely. A lot of funders use the FPL, but families may fall over even though they are living from month to month. And this question does bring to mind a kind of a one size fits all that really doesn't reflect Texas. And I'd be interested in your reaction to the question.
Chime in because honestly, this reminds me of another conversation that we actually just recently had. And Jill, this will remind you of our conversation with the Region 3 Foster Care Consortium. What that brings to mind for me is just because a family doesn't meet a certain qualification doesn't mean there isn't assistance that is needed. And we're seeing this in investigations and family-based safety services that are meant to, be family preservation in nature. We're seeing cases be dismissed or things like, families not being referred for ongoing supports just because they either didn't meet this certain definition of, a removal, or just because, something just very technical, I guess is the way I would put it. But just because they don't meet that definition or whatever that requirement is, doesn't mean that they don't need ongoing supports, doesn't mean they don't need assistance in the community. So that's what that brings to mind for me. I think that we should be approaching all things about how can we help families? How can we better support families regardless of those specific requirements?
Well, that is a perfect segue, Carrie, to the next question, which is all about data and parents. And this comes from a person who is involved with the parent collaboration group with the department and is asking, how do I go about putting data that I collect from parents' needs and strengths and struggles and complaints, needs after cases are closed, et cetera, into a system? The needs are great, the funding and lack of supports for parents, we all know the story there. And so she's trying to figure out how to help with that and to build a larger level of help for parents that provides them a better understanding of what the larger group of parents are experiencing, and to get some help with this. That's a very, very broad question, but the needs of parents are tremendous, quite obviously. And I think we've all landed on wanting to do more to promote a pro-family culture around this subject. I don't know if any of the three of you have thoughts on that you'd like to share.
A couple of thoughts, and I don't know if this gets, I'm hoping this gets at the exact intention of the question, but if what we're talking about is, one, how do I actually use this data to come up with, to advocate for policies or services or resources for families by recognizing what the needs are, but also what the strengths are to build upon. I think there's two important ways to do that. And one is to identify and partner with organizations within the community that you're serving that are providing similar services to work together and kind of collaborate and figure out how you build those strengths and how you can help bring data to the services they provide, right? So here's what I'm hearing parents need, and here's what parents are telling me they need. And here's what you're offering. Is there a way we can do X, Y, or Z? Another possibility, if you're just looking at how do I collect this data in a meaningful way and how do I make some sense out of this data, I would say, quite often universities have programs where they have students or classes that have projects or they need projects, and they'll work with communities to help them to develop systems and structures to collect and make meaning out of data. So how do you take that data and pull themes? How do you start to identify resources? So that may be another outlet if you have a university or an organization that kind of works in that kind of parent support sphere that could help with developing a systematic way to track that data so that it can be used as a tool to influence services, if I'm understanding the question correctly.
Thank you. All right, Jen or Carrie, anything on that one? I've got another great question here. And this one goes back to the subject of equity, disparities, and disproportionality. One of our attendees indicates that she was made aware of the concept of blind removals to help take race out of the equation to transform child welfare. And, she's asking, is this being discussed or studied amongst decision makers and leaders to adopt this method as a partial, at least a partial response to the continued high level of disparity and disproportionality that we see in the system?
I will chime in, but I'll have to admit that I'm having to pull from the back of my memory here. I actually was fortunate to be able to go to a Child Welfare Leagues of America conference actually recently in April of this year. And one of the breakout sessions was actually on this blind removal process. And I believe it was the folks from New York that came and talked about it. And it had jogged my memory a little bit because I remember, I believe it was when I was in the Senate, that there was a bill and there was discussion around the possibility of blind removals. And what I remember at least coming up at that time was concerns. I remember advocates kind of being concerned about the time frame, so if this was additional steps, but there was a child in the home, that there might be, obviously like an emergent safety issue. Could this potentially prolong the child being in the home? And I know at least for the New York model, anytime that's the case, there didn't have to be this additional process. This was more, I guess, for things that maybe were more risk versus immediate safety issues. So I know it has been discussed in the past. I know that there was at least some pushback on it back in, I think that was the 86th. But I'll be honest with you in saying that I know that it's being practiced in some states, but I'm not 100% sure of the, how that would be welcomed in Texas. But I can at least say that I know that that has been a discussion before.
I really love this question because I think it highlights the importance of, so we have this data that tells us something, what do we do with it? And what do we do and how do we translate that data into a solution and use it for a solution? But I will readily admit, as Carrie said, this is outside of my area of expertise. I can recall one study that I read about, but it's just one study that looked at kind of trialing this idea, and it compared removal rates and investigative processes for just looked at white children and Black children, not any other races or ethnicities, and found that removals were about the same across the board. They didn't really differ, and that children were removed for the same reasons, and that there wasn't really, so it was really interesting. And that was just one study, but I want to say that also draws to the point that we have to be careful about the context of the study, right? How many people were in the sample? Where was it done? And really to understand if that is an appropriate solution. And I haven't read the research enough to be able to say whether that is something that should be pose, something that has been found to be effective, or if it's something that should be piloted to see if it has any evidence. I'm not aware of a strong evidence base for it, but like I said, I have not done a lot of research, but I love that it was asked, because those are exactly kind of questions that we have to be thinking about, and that having access to data should be leading us to ask.
Well said, Paul, to all. Well, we've got time for, I think, one more question, and we have indeed one more question, and that comes from a participant who was thanking Carrie for calling out in the lag and the needle moving, and pointed out, and this is informational, I think, more than a question for everybody, that there is a Texas cross systems team that is wanting to be very intentional to identify factors and drivers that help understand root causes, and from that, creating strategies and target resources to address those causes, and welcoming a conversation with the members of this panel about that effort. So it is good to know, and I would add to this comment, I also understand that there is a cross-agency group discussing data practices and systems as well, that is intended to try to get down to the root shortcomings of the current systems. And so that is encouraging as well. But obviously, at the end of the day, all of this is a huge public-private partnership of all of us who are concerned for making sure that our policy solutions are truly data informed. And I want to thank you, Jill, Jen, and Carrie for doing so much today to illuminate the challenges, the concerns, and the opportunities that we have ahead in the 88th Texas Legislature, which is coming up before we know it in early January. I think that we are just about at time, so I would like to close with a thank you to all of you who have joined us here today. We will be following up by email with a recording of this Lunch and Learn session, as well as supplementary resources. We will have 2 more Lunch and Learn sessions coming up as we move through November and December to cover other topics of importance for the 88th. We will also, TexProtects will also be carrying out a virtual Texas tour of 7 communities over the weeks ahead. And so you should all be on our notification list for those things, and we encourage your participation in those endeavors as well. And once we get into the session, we will be issuing regular legislative alerts that hopefully will help you in guiding your advocacy, your own advocacy endeavors in support of these issues. Legislators obviously hear from advocates at the Capitol representing organizations, but they especially like to hear from constituents in their local districts. And so your engagement with your local representative and senator are also very, very important. I think that covers our program for today. Thank you all so much for being with us. And we wish you all the best for a great remainder of your week and weekend just ahead. Thank you so much for joining us. Bye-bye. Oh. I hope I did that okay. Right here.